Coyote Grill, Lunch with a Doc. Welcome, Wednesday, 12:30 every week. We go to different restaurants, have a good time, have a conversation. You have the chance to ask questions, talk about different topics. So, Coyote Grill, we're gonna have some good food. Come on in, let's see this place. This one's a mainstay, especially on the weekends. Lunch, breakfast, brunch, and then also for our afternoon happy hours and things like that. The bartenders, they're awesome. They're so much fun. And you got sports in here on the weekends. Check this place out. This is old school Laguna charm at its best. All right, we're already putting it in order. How's the view? Check it out.
There they are, our favorite friends on the digital matrix world. They had already introduced it, one of the coolest places ever. Check out the view.
And Raya's nickname is the Gringo Bandito. You see the resemblance? You see that? Okay.
So beautiful, huh? I mean, they didn't quite get me all the way, but
it's pretty close.
They made me look a little too attractive.
Yeah, that's when your hair was a little bit more blonde.
Yeah.
And you finally stopped wearing that round sombrero.
I know.
That was a good season for you.
Yeah, round
You were
sombrero.
known around here. Blonde, bleach blonde hair, round sombrero. Yeah.
Anyway, so what are we doing? What are we doing here? What's going on? We're at Coyote Grill. It's one of my favorite little spots. One of my friends, bar area, really good, great happy hour, calamari taco. One of the best ever, hands down. But the steak fajitas look pretty good to me today.
Yeah. Yeah, I'm gonna go with the steak fajitas with guacamole.
Actually, I'm gonna get calamari.
And what are you gonna get? Okay, we're gonna go all the way around. Still going low carb, and it's good to keep the carbs low, keep the waistline smaller than bigger. That season of my life where I looked a little bit more like Ben Franklin than I wanted to, that's over. So that is over. Yeah, that is over. That's back when I used to drink beer. I haven't had a beer in 3.5 years. Actually, 3 years and 9 months. When I got my Cyrex test back and found that I was reactive to gluten, and that was it. Gluten and corn. So that was the last time I had a taco. Knowingly, pasta that had it. I did slip up and I ate some leftover pasta that Laura left in the fridge, and I thought for sure it was gluten-free since, the kids usually only buy gluten-free pasta, and I had a few bites of that. Yeah, except for you.
How did that go for you?
I didn't really notice any big difference.
It's good.
But just knowing that, darn it, I slipped up, but not knowingly, I wouldn't order that.
Could you taste the difference?
It was pretty good. Yeah.
Pretty good.
Pretty good. So what are we going to talk about today?
I know.
Do you know?
I have a hint.
All right.
I have somewhat of an inkling.
I'm going to let you in on a little secret.
Oh man, please.
Last night, we had the first ever workshop on 7 steps to relieve neck and back pain. So the idea was to teach people how to not need a doctor as much, how to do healthy things to relieve your pain in your neck and your low back. So we thought, since we had 15 people come, we gave them all a handout, gave them a lot of good information, gave them a special offer at the end to take advantage of, and we had a good time. And so what I want to do is I want to go through some of those 7 steps with you and show you what you can do to have less pain in your body, and what some of the newest research that's out, because I like to base what I talk about not just on theories but actually on research that actually shows how things are. Are they true or are they not? So
how long have you been, discussing, talking about these issues, and how did you come to kind of formulate this this workshop?
Well, I've been talking about these issues since 1986 when I started treating patients. Started in 1987 here in Laguna, and so this is our 30th year. We are going to have our 30-year anniversary party in December.
Fun. We'll let you know more about that when it's coming up.
But I'm always trying to teach people how to do a lot of things themselves, so they don't need to be necessarily dependent on a doctor to be healthy and have the kind of quality of life they're looking for.
Yeah.
So I always thought that, the less times I can see a patient and the quicker I can get people to the level of health they want to be at, then the better, because they're going to refer so many more people. And the idea is to have people coming from all over the place just to learn how to get well and take care of themselves quicker without the need of
own their health.
Yeah, own their own health.
Yeah.
I mean, like, who's going to do it for us? If we don't do it, nobody's going to do it for you. Nobody's going to do it for me. And really, if I want a certain prize, I got to pay the price. So some of these things are just living healthy, paying the price of choosing to do healthier things. Are you doing funny stuff? Are you mimicking me?
No, I was just feeling my shoulder. I kind of tweaked my shoulder on Saturday. Body surfing.
A little body slamming and body surfing, and a little challenge along the way. So, here you go.
Why, was not laughing or something?
So, this is what we're doing today, and here we go.
Here we go. Jumping right in.
So the first thing is this.
So we're doing 7 steps.
7 steps.
7 steps.
Number 1 is determine the cause. Why are you having pain? Okay? So here's where we started with a little basic concept. And the concept is very simple. The simple concept is our bodies are made to heal themselves. You think about, number 1, 2 cells came together, 9 months later, out comes a masterpiece. You're the masterpiece. We're all a masterpiece. That healing energy that's in the body, that started the body, that blueprint was in those 2 cells coming together. The blueprint for the masterpiece was in there, and the innate intelligence, the innate healing power of the body actually called it. The genes expressed and your body was made. Now that healing power, after we're made as a baby, tells us how to grow, how tall to be, but it also heals us. So if we fall and scrape our knee, or we cut our finger, or what have you, what happens? It bleeds, then the blood coagulates, and then it forms a scab, and then it falls off. So the body goes through a natural healing process. It's when it's not healing that we start to get these messages that, hey, something's not okay, I have a symptom. But I ask a question. Is the absence of symptoms mean you're perfectly healthy? What do you think?
No.
Why?
Because not all your symptoms are causing pain. You can still have symptoms that aren't giving you pain, but are, in the long run, going to result in pain if you don't.
So, in other words, you're saying there can be problems functionally or chemically or structurally that aren't giving you a symptom yet, but they're actually going on. Can you think of an example?
Cancer.
Cancer. Cancer is one. Another example?
Your posture.
Posture?
Like you could be getting straighter and straighter and straighter neck, and it could be having no pain, and then all of a sudden you're like, wow, I'm starting to get a headache, or I'm starting to get these headaches kind of continually. Oh wow, my eyesight's blurry. I don't know.
Or pain down the arm.
Or pain down the arm.
Because you're putting so much pressure on the disc, it's pushing out the back, putting pressure on the nerves, and now, oh, I have a disc herniation. But yesterday I didn't. So I asked my dentist friends. There's some great dentists in town. If you ever need a referral, I got a couple for you.
I got you.
Yeah, I got you on that. But
you need a dentist?
call me. But the idea was, I said, hey, how long does it take for a cavity to turn into a toothache? Both of them just laughed. It's like, are you kidding me? The one said that could take 10 years, and the other one said that could take 20 years. So here you have your teeth being eaten away by a cavity, but you don't know it at all. That's why getting regular teeth cleanings are really good, because they also check for cavities. Therefore, if you do have to get a filling, then it's not going to be as big of a filling, and you're not going to need a root canal or to have your tooth yanked.
That's no fun.
No, not fun at all.
Not fun to get to that point where you have to have a root canal.
No.
Yeah.
So the reality is, you might have things going on, you might not even know it. Well, here's the deal behind this. Since our bodies are made to heal themselves, there's 4 main systems of the body. You have the structural system, you have the chemical system, you have the energetic and emotional systems. Those are the 4 main systems. If you look at all the healing arts in the world, they can basically be brought together with those 4 systems.
Amalgamated?
Yes. Stress in any of those systems help to make it so that your body's healing power can't really work. It's like interference. It can't do what it's supposed to do. The idea is to find out where the stressors are in these systems and then start to remove them through healthy lifestyle choices and appropriate care to remove the stress in those systems so your body can start to heal. Make sense? I hope so. All right, then we started talking about Dr. George Martin, one of our other chiros on staff. He gave this part. He talked about the idea is to restore your posture, restore your flexibility, and strengthen your body.
Yeah. You guys ready to order?
Yes. Sweet.
Fajitas, black beans or refried? Flour corn?
Flour corn.
Not still?
I'll go calamari tacos, flour, tortilla, refried beans. And can we get some chips and salsa?
And I'll have steak fajitas and no tortillas. I think I'll have the refried beans and and then also with the chips. Can we have? Can you guys cut me some jicama? Instead of the chips, I can't have corn. Some jicama slices. Cucumbers, okay. Yeah, order of guacamole.
You want the spicy or plain? Plain?
Okay, yeah, we'll make it spicy ourselves. Okay.
All right.
Yeah, the chips too.
All right, thank you. Okay, so let's talk real quick about posture.
So
Restoring.
that was number 2, 3, and 4, right? So
2,
number
3, and
2
4.
is restore posture.
Yeah, restore posture, work on your flexibility, and then work on strengthening your body. So the first one here is restoring posture. The gentleman here, Dr. Roger Sperry, won a Nobel Prize for brain research. He found 90% of the energy of the brain. Nobel Prize. 90% of the energy of the brain is used just to hold us in relation to gravity. So me moving my arms and sitting here, 90% of my brain energy is just relating to gravity. Standing up, walking, sitting. Only 10% has to do with organ function and healing and thinking. That's if someone has normal posture. If you don't have normal posture, then you're going to rob some of that crucial 10% just to deal with the postural distortions. The other thing is the new research is showing that if you fix your posture, a lot of times you fix other things. Like a person, you've seen a little old person as they get older, they start to go like this, and then they get like that. Well, guess what that does to the heart and to the lungs? It puts all this pressure on your lungs and your heart because your spine is tilted forward. And what that does is it makes your heart and lungs work a lot harder than they're designed to. And they found people that have that posture, on average, they die 5 years earlier. So fixing your posture fixes your health a lot of times. How do we get abnormal posture? It's usually from old injuries as kids or as adults. The way our body heals itself is you have 3 days of inflammation after an injury, but then your body will start to go into what's called a repair stage where it lays down scar tissue over the next 12 weeks. If it's not kept moving while it's healing, that scar tissue shortens and shortens and shortens and actually distorts our posture. And then the postural distortions lead to abnormal wear and tear on your discs and on your spine and cause degenerative arthritis. It's very well documented what's going on. So what do you think about that?
I think this is one of the most important topics to discuss. and have clarity on. Because if you don't understand the repercussions of poor posture, you look at a lot of health challenges down the road. You look at a lot of issues that could take a long time to repair.
Spinal surgeries, all kinds of stuff.
So like the goal of this PowerPoint then is to like make sure that you don't get to a point where you are in way over your head.
Yeah, and now you got spinal surgery. It's like, oh crap, I needed surgery. Well, if we would have just taken some time to do some work earlier, like a doctor showed me that my posture was all screwed up when I was 27, and that's why I had all these continuing health problems. I had chronic neck pain, horrible sinus problems, and chronic mid-back pain, and it was because I had healed abnormally from a bad whiplash that I was in when I was 21, and my problems had just kept on getting worse and worse. So then he showed me how to fix it. I didn't feel like I could afford it. I remember my wife saying, we can't afford not to fix it. I said, I don't want to go into debt to do it. She goes, honey, look at your x-ray. Aren't we in debt already? Shouldn't we fix that? And then we can pay off the debt. So I did it. I just dove in, kind of like the choice to put braces on crooked teeth, because you want a beautiful smile and you want straight teeth. It's of great value. So I just looked at it the same way. That had value to me, not to degenerate, to have a good quality of life, and have my pain and symptoms go away for good. Because if you fix the underlying problem, you can actually fix it for good, not just give temporary relief. So scoliosis. Scoliosis is an example. Here's what normal posture looks like. Straight spine when you look at it, curved spine when you look from the side. This girl went through what I did. She went through a postural restorative care plan. The research shows exactly what your spine is supposed to look like, so that it's like a spring to gravity, so that you don't get early wear and tear on your body. If there's distortions, that's where you got to work on. So check this out. Here's that thing I showed you as a person ages. If their gravity keeps on pushing down, once it starts to go forward, gravity keeps on pushing, and then they end up like the little old person. Here's the weight of the head. The further you get from your center of your ears being over your shoulder, the more your head weighs. And then that tightens up your spine and your low back all the way down. A lot of people's back problems is because they've got a neck problem, they just don't know it.
Interesting.
Flexibility. Your joints are supposed to move. Your whole body's supposed to move. Where there's movement, there's life. If you keep your body moving like it's supposed to, it won't degenerate before it's time, and it won't hurt. It's all about restoring movement. Exercise restores movement. Stretching restores movement. Adjustments restore movement. Massage and physiotherapies and all that stuff restore movement by breaking up muscle spasm and scar tissue and adhesions. So that's really great. Taking the time to stretch. And when you are stretching, the best thing you can do is just work on breathing. There's a system of breathing called Qigong breathing. It's 3 seconds in through your nose, 3 seconds out through your mouth. And the tongue rests on the roof of your mouth. And all you do is count your breaths, and you know like 5 breaths is going to be a 30-second stretch. So instead of counting seconds, get in touch with your breath. Your body will relax a lot better.
We did a Health Tip Tuesday on that.
Yeah, we did.
That's on our Instagram page. If you want to know more about Qigong breathing, go through that.
Yeah. Strengthening. These are really cool. These are good exercises. There's a chiro named Dr. Goodman that has foundation training. You can find him online. These are some foundation training to strengthen up your back muscles and your low back.
I recommend that to so many people.
So does Jeff Booth.
That I meet. I mean, in the water, like, oh, my back's been killing me. I'm like, just start doing foundation training like today. I mean, that's just a good, simple, easy way to like start to strengthen those low back erectors and that like butt, hamstring, like he calls it like the founding like muscle group, the core muscle group that really sustains your back, your core and stuff. Foundation training, I've done it like 6 years. I mean, when I had really bad back issues, I was doing it religiously, 3 times a day, this 12-minute exercise. I mean, my lower back muscles are really strong because of that, and it's really greatly helped improve my posture.
This here is called a prolordotic exerciser. It's like a flexible resistance band that goes behind your neck, and then you do exercises with it. Like you put it here behind your neck, and then you do like 20 to 50 yeses, 20 to 50 no's, 20 to 50 maybes, and then 20 to 50 turtles. We show how to patients how to do that. It looks like this, a little bit clearer. There's Noah Routed. He's the one who shows all of our patients how to do their exercise prescriptions, because we have very specific prescriptions. We showed some general exercises and stretches last night, but what we really recommend is specific ones for your body wherever the distortions are. So we showed people how to do some of the basic exercises. Let's talk about hydration, number 5. Hydration, your body's 70% water. You should be drinking half your body weight in ounces. So if you're 150 pounds, you need 75 ounces of water. I'm sure you can do the math on this. Your weight, divide by 2, that's how many ounces we need a day. Try to measure it out, stay hydrated. This doctor I'm going to show you.
All right, thank you so much.
Here's a great book. Your body's many cries for water. They say you're not sick, you're thirsty. Consider that if you really want to find out more about hydration. If anybody can pronounce his last name, I'll give you a free B12 shot. I won't, but the nurse will. But he's a medical doctor that's researched hydration quite a bit. And remember, the discs in your spine are the last things to get hydrated. So if you're dehydrated, those discs are going to be wearing and tearing, and they're like a dry sponge. Dry sponge, not so good.
Yeah.
Number 6, decrease inflammation. Time Magazine, 2000, what was it, 2004, 2005? What's that say on there, young eyes?
2004.
2004. The secret killer, inflammation. The surprising link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. Inflammation is really what's causing it. How do we fight inflammation? Let me show you. Quick and easy. Number 1, you understand that inflammation causes more pain. So how to decrease your inflammation? Get hydrated. Number 2, there's a lot of supplements. Magnesium, fish oils, resveratrol, vitamin D, antioxidants, detoxifying nutrients, blueberries, ginger, turmeric, broccoli. We give you handouts for all this when you come to it, and we will be having another one of these because we had such good response, and we're going to open it up more to the general public, so it'll be very crowded. Stay off of MSG. It's horrible. It will cause inflammation. Stay off of diet drinks. Diet drinks are horrible. They cause calcification of your brain. They lead to Alzheimer's. It's horrible. Get off of diet drinks. Yeah, get off of aspartame. Control your blood sugar. You don't want your blood sugar to go up and down, so make sure you build your meal around the protein source every meal. Get your exercise in, and get chiropractic adjustments and turn down the pain. This has been researched. When you get a manipulation into a joint, it gets movement back. Movement is what turns down pain, and it decreases the inflammatory response. We have now found out about this arachidonic acid EPA blood test. It's a $70 test. You do it yourself. You get this little packet. It's got a little pinprick, and you take your blood sample and you put it onto a little piece of paper. It only costs $70. And what's cool about it?
Steak fajitas.
And you just pay for the lab fee to get it, but it's going to give you a ratio. Arachidonic acid is pro-inflammatory. Genetically modified foods, overuse of alcohol, overuse of dairy, overuse of these genetically modified foods increase arachidonic acid. Arachidonic acid makes you hurt more and makes you degenerate more, gives you heart attacks, gives you cancer. So what you want is a smaller ratio of arachidonic acid to EPA, which is fish oil. And you want to make sure you get a good fish oil with no heavy metal contaminants, so it has to be micro distilled. But the reality is this: if you have a smaller ratio, the healthier you're going to be. So they basically don't want you to have a higher than 4-to-1 ratio. But guess what they did? A national average of random population in America, 25-to-1. So the American public is like a a bubbling cauldron of inflammation that's causing degeneration, that's causing pain, that's causing Alzheimer's, cancer, all this stuff. Some of the most horrible criminals have ratios up in 40, 50, 60, 70, 80 to 1. Their brains are so inflamed they're not rational, they do horrible things. That's great. Yeah. So inflammation is really key. Oh my goodness. That's beautiful.
That's the ticket right there.
Thank you so much. Okay.
That's the
Can I get you anything else here?
We are so good.
Wow. I love this TV show. I get to eat a great meal every week and come talk about things I love and hopefully make a difference in other people's lives. The steam.
What a silly man.
All right, we talked about inflammation. That was number 6. And number 7. I'm going to get there. Oh,
Still steaming.
pretty simple. Get the care you need. Like if you do your healthy lifestyle, home care stuff, and you make good choices to eat organic, good food, drink your water, all that, that's all under home care. The other part is the in-office care. Just get the care that you need so you actually get better. You're not stuck. You can get better, but it's like gear systems. Gear systems make things move. Find somebody. If it's not us, find somebody that you trust and respect that can really do a good, solid workup. Find out where your challenges are and start working on fixing them. Time's going to go by one way or another. A year's going to go by. You're either going to be better or you're going to be worse. But gravity never stops on any of us, do they? It doesn't. So you got to put in the time. If you want the prize, you got to pay the price. So, we have a gift for you. You'd have to call in. You'd probably have to come to a workshop to get this special price. But what we do is we give people a very intensive workup, take postural x-rays, get a medical evaluation with our family nurse practitioner, Rochelle Rodriguez, who's an amazing nurse practitioner. We do all of that. It's normally about $700 for that kind of evaluation. And for just this week, if you call, you can set up a whole exam, whatever is needed for $97. And we'll sit down and talk with you about the results. No pressure. If you want to do the work, we'll help you do it. If not, at least you got our vantage point of what's going on and what you can do to get better. So, what are you thinking about at this point after all that's been said? We went over a lot of material.
I think that information is vital, crucial. I could literally watch this video again, take notes, and then implement it into my life. But I've been blessed to grow up with this guy, so all these things that he's talking about, it's kind of intuitive now and habitual. So for those of you out here who isn't, this is a really important thing. We'll be sending out this video in a couple weeks. You can rewatch it, come to the next workshop, and or you can just come and see us. You can come in Health and Balance, 497-2553, area code 949. Check us out, healthandbalance.com. We love to help you. We want to see you improve and be your best self you can, and that includes health. So we're
Coming
gonna.
up on September 21st.
Ooh, that is our Community Appreciation Day. Free treatment all day, free B12 shots. So we'd love to see you. If you need some work, you need some help, need some love, it's a great way to come and just introduce yourself, let us introduce ourselves, and get your body worked on for free for that day. That's going to be September 21st. September 21st. And then after that, in December, we're going to be having our 30th anniversary, so we'll let you know about that coming up. But we're going to go ahead and enjoy these amazing steak fajitas at Coyote Grill, so we're so appreciative to them for hosting us today. We thank Coyote Grill, we love Coyote Grill. But yeah, we love you guys too, so we'll see you next Wednesday.
You
are amazing.